Chapter 6, Timby MedSurg, topic, culture and ethnicity. Clients vary according to age, gender, race, health status, education, religion, occupation, and economic level. Culture, the focus of this chapter, is yet another characteristic that contributes to client diversity, which is defined as differences among groups of people. Nurses have always cared for clients with differences of some sort. Despite cultural differences, the traditional tendency has been to treat clients as though no differences exist. Although equal treatment may be politically correct, many nurses now believe that ignoring differences contradicts the best interests of clients. Consequently, there is a movement toward eliminating acultural nursing care, which is care that avoids concern for cultural differences, and promoting culturally sensitive nursing care that respects differences and cultures and is compatible with each client's culture. This information will provide cultural concepts, cultural variations among different ethnic and racial groups, and intercultural communication. Although components of culture are specific to a particular group of people, individual clients within each cultural group may deviate from others of similar origins. Therefore, nurses are advised to always consider cultural needs from an individual's perspective. Every human being is in some way like all others, like some others, and like no other. Culture is defined as the values, beliefs, and practices of a particular group that incorporates the attitudes and customs learned through socialization with others. It includes, but it is not limited to, language, communication style, traditions, religion, art, music, dress, health beliefs, and health practices. A group's culture is passed from one generation to the next. According to Hinkle and Cheever, culture is 1. Learned from birth, 2. Shared by members of a group, and 3. Influenced by environment, technology, and the availability of resources, and 4. Dynamic and ever-changing. Although the U.S. has been described as a melting pot in which culturally diverse groups have become assimilated, that is not the case. People from various cultural groups have settled, lived, and worked in the U.S. while continuing to sustain their unique identification with culture. Is the following statement true or false? Currently, there is a movement towards acultural nursing care. False. Currently, there is a movement toward promoting culturally sensitive nursing care and eliminating acultural nursing care. Which of the following is a characteristic of culture? Is it A, acquired from other groups, B, averse to environmental influences, C, learned from birth, or D, constant and non-changing? The answer is culture is learned from birth. It is not acquired from other groups, but shared by members of a group. It is influenced by environment, technology, and resources. It is also dynamic and ever-changing, not constant. Race. Cultural groups tend to share biologic and physiologic similarities. Race is defined as biologic variations, is a term used to categorize people with genetically shared physical characteristics. Some examples include skin color, eye shape, and hair texture. Despite wide ranges in physical variations, skin color has traditionally been the chief, albeit imprecise, method for dividing races into Mongoloid, Negroid, and Caucasian. Skin color is just one of a variety of inherited traits. More importantly, nurses should not equate race with any particular cultural group. To do so leads to 2 errors and assumptions. That 1, all people with common physical features share the same culture, and 2, all people with physical similarities have cultural values, beliefs, and practices that differ from those of Anglo-Americans, which are defined as U.S. whites who trace their ancestry to the United Kingdom and Western Europe. Minority. The term minority is used when referring to those collective people who differ from the dominant group in terms of cultural characteristics such as language, physical characteristics such as skin color, or both. Minority does not necessarily imply that there are fewer group members in comparison with others in the society. Rather, it refers to the group's status with regard to control and power. For example, men of European ancestry are the current majority in the U.S. Slightly more women than men make up the population of the U.S., yet women are considered a minority. According to the U.S. Census Bureau in 2012, the population of those who identified themselves as white will slowly decrease by the year 2060. By 2060, the number of Latinos and Asian Americans living in the United States is expected to more than double, and the number of African Americans will rise slightly to 14.7%, and the United States population American Indians and Alaskan Natives will increase by more than half to 1.5% of those living in the U.S. The population of Native Hawaiian and other Pacific Islanders is expected to nearly double. This is per the U.S. Census Bureau in 2012. Minorities as a whole will comprise 57% of the population by 2060. However, until these groups acquire more political and economic power in society, they will continue to be classified as minorities. Gerontological considerations. Between 2010 and 2050, 60% of the projected growth in the population of older adults in the United States will be among older minorities. Ethnicity. Ethnicity is defined as a bond or kinship or a person feels with his or her country of birth or place of ancestral origin that may exist regardless of whether or not a person has ever lived outside the United States. Pride in one's ethnicity is demonstrated by valuing certain physical characteristics, giving children ethnic names, wearing unique items of clothing, appreciating folk music and dance, and eating native dishes. Because cultural characteristics and ethnic pride represent what may be considered the majority in a homogeneous group, they tend to go unnoticed. When two or more cultural groups mix, however, as often happens at the borders of various countries or through the process of immigration, unique differences become more obvious. One or both groups may experience cultural shock, which is bewilderment over behavior that is culturally atypical. Consequently, many ethnic groups have been victimized as a result of bigotry based on stereotypical assumptions and ethnocentrism. Factors that affect perception of individuals. Stereotyping. Stereotypes are fixed attitudes about all people who share a common characteristic, developed with regard to age, gender, race, sexual preference, or ethnicity. Because stereotypes are preconceived ideas usually unsupported by facts, they tend to be neither real nor accurate. In fact, they can be dangerous because they interfere with accepting others as unique individuals. Ageism is a form of negative stereotypical thinking about older adults. It promotes false beliefs about older adults being physically and cognitively impaired, lacking interest in sex, and being burdensome to families and society. Generalization is a supposition that a person shares cultural characteristics with others of a similar background. This is different from stereotyping. Stereotyping prevents seeing and treating another person as unique, whereas generalizing suggests possible commonalities that may or may not be individually valid. Assuming that all people who affiliate themselves with a particular group behave alike or hold the same beliefs is always incorrect. Despite being what appears to be a homogeneous group, diversity exists among individuals. A generalization provides a springboard from which to explore a person's individuality. For example, when a nurse is assigned to care for a terminally ill client whose last name is Vasquez, the nurse may assume that the client is Roman Catholic because Catholicism is the religion of most Latinos. Before contacting a priest to assist with the client's spiritual needs, however, the nurse understands that the generalization concerning religion may not be accurate. A culturally sensitive nurse strives to obtain information that confirms or contradicts the original generalization. Ethnocentrism is the belief that one's own ethnicity is superior to all others, has no place in intercultural relationships. Ethnocentrism is manifested by treating anyone different as deviant and undesirable. This form of cultural intolerance was the basis for the Holocaust, during which the Nazis attempted to carry out genocide, the planned extinction of an entire ethnic group, in this case European Jews, and very nearly did, with a number of 6 million Jews murdered. Ethnocentrism continues to play a role in the ethnic rivalries between pro-Russian separatists in Ukraine, Arabs and Jews in the Middle East, the Boko Haram in Nigeria, Islamic State of Iraq, and Syria, ISIS militants in the Middle East, and other regions where culturally diverse groups live in close proximity. Similar conflicts also occur among ethnic groups in the U.S., such as the cluster of Muslims who live in Dearborn, Michigan, and other residents. Is the following statement true or false? Minority implies that there are fewer group members in comparison with others in the society. False. Minority does not necessarily imply that there are fewer group members in comparison with others. Rather, it refers to the group's status in regard to power and control. Culture and subcultures in the U.S. Culture in the U.S. can be described as anglicized or English-based because it evolves primarily from its early English settlers. To suggest that everyone who lives in the U.S. embraces the totality of its culture, however, would be erroneous and foolhardy. Although it is a gross oversimplification, 4 major subcultures, which are unique cultural groups that coexist within the dominant culture, exist in the U.S. In addition to Anglo-Americans, there are also African Americans, Latinos, Asian Americans, and Native Americans, like the Lakota Sioux. The 2010 census allowed individuals to self-select from 7 race and ethnicity categories. The term African Americans is used to identify those whose ancestral origins is Africa. It is sometimes used interchangeably with Black Americans. Latinos, a shortened term for Latino Americano, refers to those who trace their ethnic origin to Mexico, Puerto Rico, Cuba, Central and South America, or other Spanish-speaking countries such as the Dominican Republic. However, Latinos are sometimes referred to as Hispanics, a term coined by the U.S. Census Bureau when referring to those residing in the eastern portion of the U.S., such as Florida and Texas. The term Mexican American is the preferred term used when referring to people from Mexico who were born in the U.S. Chicano is a relatively recent term used by some Americans of Mexican descent, although initially it was a discriminatory term. Asian Americans, those who come from the Far East, Southeast Asia, and the Indian subcontinent such as China, Japan, Korea, the Philippines, Thailand, Laos, Vietnam, India, Pakistan, and Afghanistan, to name a few, make up the 3rd subculture. Native Americans include persons who have had their origins in North, Central, and South America, as well as Eskimos and Aleuts, all of whom belong to 566 federally recognized tribes in the U.S. This is per the Department of Interior Bureau of Indian Affairs in 2015. Although Anglo-Americans' culture predominates in the U.S., those of African, Asian, Latino, Hispanic, Native American, and Hawaiian Pacific Islander descent will soon outnumber those who trace their ancestry to the United Kingdom and Western Europe. As the population of non-Anglo-Americans rises and becomes more diverse, the need for cultural competence in nursing is increasingly urgent. 4 major subcultures in addition to Anglo-Americans. Review: African Americans, Latinos, Asian Americans, and Native Americans, which I just mentioned. African Americans are those whose ancestral origin is Africa, sometimes called Black Americans, although that can be an issue. Latinos, those from Latin America or South America, Hispanics or Chicanos, people from Mexico. Asian Americans are those from China, Japan, Korea, the Philippines, Thailand, Cambodia, Laos, and Vietnam. and Native Americans are those from North America that include Eskimos and Aleuts. Transcultural nursing. Madeline Leninger, 1925 to 2012, coined the term transcultural nursing, which is providing nursing care within the context of another's culture, in the 1970s. Aspects of transcultural nursing include the following: assessments of a cultural nature, acceptance of each client as an individual, knowledge of health problems that affect particular cultural groups, planning of care within the client's belief system to achieve the best health outcomes. And to provide culturally sensitive care, nurses must become skilled at managing language differences, understanding biologic and physiological variations, promoting health education that will reduce prevalent diseases, and respecting alternative health beliefs or practices. Cultural assessment. To provide culturally sensitive care, the nurse strives to gather data about the unique characteristics of clients. Pertinent data includes the following: language and communication style, hygiene practices, including feelings about modesty and accepting help from others, special clothing or ornamentation, religion and religious practices, rituals surrounding birth, passage from adolescence to adulthood, illness and death, family and gender roles, including child-rearing practices and kinship with older adults, proper forms of greeting and showing respect, food habits and dietary restrictions, methods for making decisions, health beliefs, and medical practices. Assessment of these areas is likely to reveal many differences. Examples of variation include language and communication, eye contact, space and distance, touch, emotional expressions, dietary customs and restrictions, time, and beliefs about the cause of illness. Language and communication. Because language is the primary way to share and gather information, the inability to communicate is one of the biggest deterrents to providing culturally sensitive care. Foreign travelers and many residents in the U.S. do not speak English, or they have learned it as their second language and do not speak it well. Estimates are that 59.5 million of those who live in the U.S. speak a language other than English at home. Spanish is the most often spoken language other than English in the U.S. Those who can communicate in English may still prefer to use their primary language, especially under stress. Equal access. Federal law, specifically Title IX of the Civil Rights Act of 1994, states that people with limited English proficiency, called LEP, and inability to speak, read, write, or understand English at a level that permits interacting effectively are entitled to the same health care and social services as those who speak English fluently. In other words, all clients have a right to unencumbered communication with a health provider. Using children as interpreters or requiring clients to provide their own interpreters is a civil rights violation. The Joint Commission requires that hospitals provide effective communication for each client. The use of untrained interpreters, volunteers, or family is considered inappropriate because it undermines the confidentiality and privacy. It also violates family roles and boundaries. It increases the potential for modifying, condensing, omitting, adding information, or projecting the interpreter's own values during communication between the client and the healthcare provider. The best form of communication with a language limited English proficiency person is with a certified interpreter. A certified interpreter is a translator who is certified by a professional organization through rigorous testing based on appropriate and consistent criteria. Unfortunately, individuals who meet these qualifications are few and far between. To comply with the laws and accreditation requirements, healthcare agencies are strongly encouraged to train professional interpreters. Back to culture. Latinos will sit close to interviewer, let interactions unfold slowly, whereas Asian Americans respond with brief, factual answers, and may not openly disagree with authority figures, which is potentially fostering noncompliance. Which of the following clients may provide brief, factual answers with little elaboration during a healthcare interview? A Native American, an African American, a Latin American, or an Asian American? Asian American. Asian Americans tend to respond with brief or more factual answers and little elaboration. A Native American may be private and may hesitate to share personal information with strangers. An African American may be mistrustful of the medical establishment. A Latin American may be comfortable sitting close to interviewers and letting interactions unfold slowly. Eye contact. Anglo-Americans make and maintain eye contact throughout communication, looking directly at a person while speaking. Asian Americans or Native Americans may believe direct eye contact is an invasion of privacy or a sign of disrespect. Arabs may believe direct eye contact is sexually suggestive. Space and distance. Providing personal care and performing nursing procedures are affected by a person's space and distance requirements. Asian Americans are more comfortable with nurse at greater than an arm's length away. Touch. Native Americans may interpret strong handshakes as offensive. Southeast Asians, head is a sacred body part that only close relatives can touch, and an area between a female's waist and knees is private. Emotional expression. Anglo-Americans and African Americans are freely expressive. Asian Americans control emotions and expressions of physical discomfort. Latino men may not demonstrate feelings. Beliefs concerning illness. Generally, people embrace one of three cultural views to explain illness or disease. The biomedical or scientific perspective is shared by those from developed countries who base their beliefs about health and disease on research. An example of a scientific perspective is that microorganisms cause infectious diseases and frequent hand hygiene reduces the potential for infection. The naturalistic or holistic perspective believes that humans and nature must be in balance or harmony to remain healthy. Illness is an outcome of disharmony. Native Americans believe that positive outcomes result from living in congruence with Mother Earth. Another example includes Asian Americans who uphold the yin-yang theory, which refers to the belief that balanced forces promote health. Latinos embrace a similar concept referred to as the hot-cold theory. It implies that illness is an imbalance between components ascribed to as having hot or cold attributes. Adding or subtracting heat or cold to restore balance also restores health. Finally, there is the magico-religious perspective, in which there is a cultural belief that supernatural forces contribute to disease or health. Some examples of the magico-religious perspective include cultural groups such as the Haitians, who accept faith healing or practice forms of witchcraft or voodoo. Native Americans have a strong reverence for the great creator's influence on health and illness. They use herbs and spiritual rituals performed by a tribal leader or medicine men known as shamans to relieve illness. Although nurses may disagree with the client's beliefs concerning the cause of health or illness, respect for the person helps to achieve healthcare goals. As long as a culturally held health belief or practice is not harmful, the nurse should incorporate it into the client's care. Always incorporate a client's health beliefs in his or her own care. Because Native Americans have a strong belief in the great creator's influence on health and illness, the tribal medicine man plays a major role in the care of a Native American client's illness. Biologic and physiologic variations. The biologic characteristics of primary importance to nurses are those that involve the skin, hair, and certain physiologic enzymes. Skin characteristics. Skin assessment techniques that are commonly taught are biased toward white people. To provide culturally sensitive care, nurses must modify their techniques to obtain accurate data on people of color. The best technique for observing baseline skin color in a dark-skinned person is to use natural or bright artificial light. Because the palms of the hands, the feet, and the abdomen contain the least pigmentation, and are less likely to have been tanned, they are often the best structures to inspect. According to Geiger in 2013, all skin, regardless of a person's ethnic origin, contains an underlying red tone. Its absence or a lighter appearance indicates pallor, a characteristic of anemia or inadequate oxygenation. The color of the lips and nail beds, common sites for assessing cyanosis in whites, may be highly pigmented in other groups, and nurses may misinterpret normal findings. The conjunctiva and oral mucous membranes are likely to provide more accurate data. The sclera, or the hard palate, rather than the skin, is a better location for assessing jaundice. In some people of color, the sclera may have a yellow cast from carotene and fatty deposits. Nurses should not misconstrue this finding as jaundice. Rashes, bruising, and inflammation may be less obvious among people with dark skin. Palpating for variations in texture, warmth, and tenderness is a better assessment technique than inspection. Keloids, which are irregular, elevated, thick scars, are more common among dark-skinned clients. They are thought to form from a genetic tendency to produce excessive transforming growth factor beta, TGF-beta, a substance that promotes fibroblast proliferation during tissue repair. Some nurses, when bathing a dark-skinned person, misinterpret the brown discoloration on a washcloth as a sign of poor hygiene. In reality, this is due to the normal shedding of dead skin cells, which retain their pigmentation. Hyperpigmentation or hypopigmentation are conditions in which the skin is not a uniform color. Hypopigmentation may result when the skin becomes damaged. Regardless of ethnic origin, damaged skin characteristically manifests temporary redness, which then fades to a lighter hue. In dark-skinned clients, the effect is more obvious. Vitiligo, a disease that affects whites as well as those with darker skin, produces irregular white patches on the skin as a result of an absence of melanin. Other than hypopigmentation, there are no physical symptoms, but the cosmetic effects may create emotional distress. Clients concerned about the irregularity of their skin color may use a pigmented cream to disguise noticeable areas. Mongolian spots, an example of hyperpigmentation, are dark blue areas on the lower back and sometimes on the abdomen, thighs, shoulder, or arms of darkly pigmented infants and children. Mongolian spots are due to the migration of melanocytes into fetal epidermis. They are rare among whites and tend to fade by the time the child is 5 years old. Nurses unfamiliar with ethnic differences can mistake Mongolian spots as a sign of physical abuse or injury. Then they can differentiate between the two by pressing the pigmented area. Mongolian spots will not produce pain when pressure is applied. And there's a nice picture of this on page 86 of a newborn with Mongolian spots. Hair characteristics. Hair color and texture are also biological variants. Dark-skinned people usually have dark brown or black hair. Hair texture, also an inherited characteristic, results from the amount of protein molecules within the hair. Variations range from straight to very curly. The curlier the hair, the more difficult it is to comb. In general, using a wide-toothed comb or pick, wetting the hair with water before combing, or applying a moisturizing cream makes grooming more manageable. Some African Americans prefer to arrange their hair in small, tightly braided sections. Enzymatic variations. 3 inherited enzymatic variations are prevalent among members of the various United States subcultures. They involve an absence or insufficiency of the enzyme lactase, glucose 6-phosphate dehydrogenase, which is known as G6PD, and alcohol dehydrogenase, which is ADH. Lactose deficiency. Lactose is a digestive enzyme that converts lactose, the sugar in milk, into the simpler sugars called glucose and galactose. A lactose deficiency, common among African Americans, Hispanics, and Chinese, causes intolerance to dairy products. Without lactase, people have cramps, intestinal gas, and diarrhea approximately 30 minutes after ingesting milk or foods that contain it. Symptoms may continue for 2 hours. Eliminating or reducing sources of lactose in the diet may prevent the discomfort. Liquid tube feeding formulas and those for bottle-fed infants can be prepared using milk substitutes. Because milk is a good source of calcium, which is necessary for health, Nurses should teach affected clients to obtain calcium from other sources, such as green leafy vegetables, dates, prunes, canned sardines and salmon with bones, egg yolks, whole grains, dried peas and beans, and calcium supplements. GPD deficiency. G6PD is an enzyme that helps red blood cells metabolize glucose. African Americans and people from Mediterranean countries commonly lack this enzyme. This disorder is manifested in males because the gene is sex-linked, but females can carry and transmit the faulty gene. A G6PD deficiency makes red blood cells vulnerable during stress, which increases metabolic demands. When this happens, red blood cells are destroyed at a much greater rate than in unaffected people. If the production of new red blood cells cannot match the rate of destruction, anemia develops. Because several drugs can precipitate the anemic process, it is important for the nurse to intervene if these drugs or those that depress red blood cell production are prescribed for clients who are at greatest risk. At the very least, the nurse must monitor susceptible clients and advocate for lab tests such as red blood cell count and hemoglobin levels, which will indicate any adverse effects. Alcohol dehydrogenase deficiency. When a person consumes alcohol, a process of chemical reactions involving enzymes, one of which is alcohol dehydrogenase ADH, eventually breaks down the alcohol into acetic acid and carbon dioxide. Asian Americans and Native Americans often metabolize alcohol at a different rate than other groups because of physiologic variations in their enzymes. The result is that affected clients experience dramatic vascular effects such as flushing and rapid heart rate soon after consuming alcohol. In addition, middle metabolites of alcohol, those formed before acetic acid, remain unchanged for a prolonged period. Many scientists believe that the middle metabolites, such as acetaldehyde, are extremely toxic and subsequently play a primary role in causing organ damage. The rate of alcoholism among Native Americans is 6 times higher than the U.S. average. 1 in 10 Native American deaths is alcohol-related. Pharmaceutical studies demonstrate that genetic variations in racial groups can influence medication outcomes. For example, certain drug classes used for psychological illnesses, such as those for depression or schizophrenia, reduce symptoms better for African American and Asian clients than other classes of drugs. Protein variations in the genetic code are thought to influence these differences. Disease prevalence. Several diseases, including sickle cell anemia, hypertension, diabetes, and stroke, occur with much greater frequency among ethnic subcultures than in the general population. The incidence of chronic illness affects morbidity differently as well. The incidence of some chronic diseases and their complications may be related partly to variations in social factors such as poverty. Minority cultural groups tend to be less affluent, consequently their access to expensive health care often is limited. Without preventive health care, early detection and treatment and higher death rates are bound to occur. The U.S. therefore has committed itself to reducing the disparity in health care among all Americans. With the knowledge that special populations are at increased risk for chronic disease, culturally sensitive nurses focus heavily on health education, participate in the community health screenings, and campaign for more equitable health care services. Health beliefs and practices. Many differences in health beliefs exist among U.S. subcultures. They persist as a result of strong ethnic influences. Health beliefs then affect health practice. Folk medicine, defined as health practices unique to a particular group of people, has come to mean the methods of disease prevention or treatment outside mainstream conventional practice. Generally, lay providers, rather than formally educated and licensed individuals, give such treatments. In addition to culturally specific health practices, such as those sought from a curandero, which is a Latino practitioner who is thought to have spiritual and medicinal powers, a shaman, or an herbalist. Many people in the U.S. also turn to complementary and alternative medicine, called CAM, those therapies that are used in addition to or instead of conventional medical treatment, for which there is some scientific evidence of safety and effectiveness. Now, CAM is now being referred to as integrative therapy. CAM attracts people for various reasons. Mainstream medical care is expensive. There may be dissatisfaction with prior treatment or progress. Family or acquaintances may provide testimonials about their efficacy, or persons may feel intimidated by the healthcare establishment. Just because a health belief or practice is different does not make it wrong. Culturally sensitive nurses respect the client's belief system and integrate scientifically based treatment along with folk and quasi-medical practices. Refer to Table 6-7 on page 88 in Fundamentals Timby for additional health beliefs and practices as they relate to various religions. Examples of alternative medical therapy. Homeopathy is based on the principles of similars. It uses diluted herbal and medicinal substances that cause similar symptoms of a particular illness in healthy people. For example, quinine is used to treat malaria because it causes chills, fever, and weakness, which are symptoms of malaria, when administered to healthy people. Naturopathy uses botanicals, nutrition, homeopathy, acupuncture, hydrotherapy, and manipulation to treat illness and restore a person to optimal balance. Chiropractic is based on the belief that illnesses and pain result from spinal misalignment. It uses manipulation and readjustment of joint articulations, massage, and physiotherapy to correct dysfunction. Environmental medicine proposes that allergies to environmental substances in the home and workplace affect health, particularly for supersensitive people. It advocates reduced exposure to chemicals to control conditions that mainstream physicians have failed to diagnose or underdiagnosed. Culturally sensitive nursing. Accepting that the U.S. is multicultural is the first step toward culturally sensitive, competent nursing care. The following recommendations are ways to demonstrate culturally sensitive nursing care. Use culturally sensitive techniques to improve interactions, such as sitting in the client's comfort zone and making appropriate eye contact for that culture. Become familiar with physical differences among ethnic groups. Perform physical assessments, especially of the skin, using techniques that provide accurate data. Learn or ask clients about cultural beliefs concerning health, illness, and techniques for healing. Consult the client on ways to solve problems. Never verbally or non-verbally ridicule a cultural belief or practice. Integrate helpful or harmless cultural practices within the plan of care. Modify or gradually change culturally unsafe health practices. Avoid removing religious medals or clothes that hold symbolic meaning for the client. If they must be removed, keep them safe and replace them as soon as possible. Provide culturally preferred food. Advocate for routine screening for diseases to which clients are genetically or culturally prone. Facilitate rituals by the person or the client to the person the client identifies as a healer within his or her belief system. Apologize if cultural traditions or beliefs are violated. Learn to speak a second language. Again, reviewing. Consult the client on ways to solve health problems. Never ridicule a cultural belief or practice. Integrate helpful or harmless cultural practices within the plan of care. Modify or gradually change unsafe practices. Provide customarily eaten food. Advocate routine screening for genetically, culturally prone diseases. Facilitate rituals by a healer identified by the client. And apologize if cultural traditions or beliefs are violated. This is the end of the slideshow.